Imagine being on high alert every second, like a switch you can't turn off. You're always tense, always on edge. Every noise, every movement around you feels like a threat. It's exhausting, but this is the reality for people dealing with hyperarousal, a state where anxiety, irritability, and restlessness become constant companions. It's not just a feeling, it's a symptom of something much bigger, PTSD. Today, let's explore hyperarousal, why it happens, what it feels like, and how you or someone you know can start managing it. What is hyperarousal? Hyperarousal is a state of heightened sensitivity, almost like your brain has gone into overdrive, responding to everything around you as if it were dangerous. This isn't just regular stress. Hyperarousal is one of the most common symptoms of post-traumatic stress disorder, PTSD, often caused by a traumatic event like a car accident, an assault, or military combat. PTSD puts your body in constant fight or flight mode, even when there's no actual threat. When you're hyperaroused, your body responds to everyday sounds and movements as if they're alarms. You might find it hard to fall asleep, concentrate, or even just relax. You could feel your heart racing more often, your muscles tense up, or you're startled at the smallest things. For some, even trying to sit still feels impossible. It's exhausting, overwhelming, and can feel like there's no escape. Symptoms of hyperarousal. The symptoms of hyperarousal can show up in many ways, making it difficult to get through everyday life. Here are some common signs to look for. Sleep problems, finding it hard to fall asleep, stay asleep, or waking up feeling tired. Irritability, losing your temper easily, sometimes over things that don't usually bother you. Difficulty concentrating, struggling to focus on tasks, even ones you enjoy. Hypervigilance, always feeling on guard, as if danger could strike at any moment. Impulsivity, making quick decisions without thinking through the consequences. Increased physical sensitivity, feeling pain more acutely, experiencing muscle tension, or having a racing heartbeat. Hyperarousal affects everyone differently, and the symptoms can come and go. Sometimes they're triggered by something specific, a smell, a sound, or even a word. Other times, they seem to appear out of nowhere, leaving you feeling overwhelmed and exhausted. Why does hyperarousal happen? At its core, hyperarousal is rooted in trauma. When the brain experiences something deeply distressing or life-threatening, it can respond by staying in a heightened state of alertness. This makes sense in a dangerous situation. But when this state of alertness doesn't turn off afterward, it becomes a part of daily life, known as hyperarousal. Hyperarousal is most commonly associated with PTSD, but it can also be triggered by events like alcohol withdrawal. PTSD is often the result of a traumatic event, anything from a robbery or car crash to childhood abuse, military experiences, or natural disasters. The brain processes these experiences as a threat, which can lead to long-lasting changes in how you respond to stress, sometimes even years later. Coping strategies for hyperarousal. Managing hyperarousal isn't about just relaxing, it takes effort and specific techniques to help ease the symptoms. Here are some ways people with hyperarousal can start to take back control. 1. Improving sleep. For many with hyperarousal, sleep can be elusive. Try some of these techniques. Stick to a consistent sleep schedule. Avoid caffeine after midday. Limit naps, so you're sleepier at night. Reduce screen time, especially in the bedroom. Practice deep breathing or relaxation techniques before bed. 2. Managing anger. Hyperarousal can make it difficult to keep emotions in check, especially anger. To release these emotions more constructively, exercise or dance to burn off energy. Talk to someone who listens without judgment. Write about what's bothering you. Use deep breathing to calm your body. 3. Improving focus. If concentration is difficult, here are some tips to help. Create a distraction-free work environment. Break tasks into smaller parts and focus on one at a time. Practice mindfulness, bringing your attention back to the present moment. 4. Curbing impulsivity. Impulse control can be challenging, especially when you're constantly on edge. Try these strategies. Replace impulsive actions with positive activities, like writing or drawing. Talk about your feelings with someone you trust. Take a moment to breathe before reacting to strong emotions. Supporting loved ones with hyperarousal. If you have a loved one experiencing hyperarousal, it can be tough to know how to help. The best thing you can do is offer understanding, not judgment. Listen when they need to talk, and help them feel heard. Encourage them to try some of the techniques we've talked about, or even try them together. Practicing mindfulness, meditation, or simply breathing exercises with them can create a supportive environment. Being there for someone means not overreacting to their symptoms, even if it's hard to understand. Remember, they may not always be able to control their reactions. What they need most is your patience and your presence. Professional treatment options. For those with hyperarousal and PTSD, professional treatment can make a huge difference. Here are a few common approaches. Exposure therapy, safely confronting traumatic memories to reduce fear and anxiety. Eye movement desensitization and reprocessing, EMDR, uses eye movements to help reprocess traumatic memories. Cognitive behavioral therapy, CBT, teaches practical ways to cope with negative thoughts and reactions. In some cases, a doctor might also recommend medication to manage hyperarousal and other PTSD symptoms. Talking to a professional can open doors to treatments that are tailored to individual needs and situations. Final thoughts? Hyperarousal can make life feel like a constant struggle, but it's important to remember that you're not alone, and there are ways to regain control. By understanding the symptoms, the causes, and effective ways to cope, you can start to reduce hyperarousal's grip on your daily life. For anyone who might recognize these symptoms in themselves or someone they care about, reaching out for help is one of the bravest steps you can take. A doctor, therapist, or even a supportive friend can make a difference. Remember, while PTSD can be a long-term condition, there's hope. With the right strategies and support, people can, and do, find relief. Thank you for joining today's discussion on hyperarousal. Remember, no matter where you're starting from, help is available, and better days are within reach.